Hi, my name is Melanie and I am your IVF nurse. Today's topic is going to be about what to expect during your egg retrieval. So I'm not going to cover much of the clinical or technical terms of what happens during an egg retrieval, but from a patient perspective, what you can expect. So once you've done your trigger shot, it's usually about 35 to 36 hours before your scheduled egg retrieval time. Now, what will happen is when you go to the clinic that morning, you'll be met at front reception and you may be told to have a seat. In some clinics, and every clinic is a little bit different, so in some clinics you may meet with the doctor first just to review any questions you may have so that you have a good understanding of what's going to happen. You may be taken back to the pre-op area by the nurse there who's going to get you ready. So essentially, what you're going to do is make sure that all your consent forms are signed the morning of the procedure. They should always be submitted in advance, but usually that's like the last time to make sure that all of your consent forms are signed and that you have a good understanding of what's going to happen. Now, when you're doing your pre-op, the nurse will ask you, or you may meet with an anesthesiologist depending on who is doing your sedation, to review that you have been NPO or had nothing to eat from midnight the night before. This is important because the medications that they will give you may cause you to feel nauseated, dizzy, you may have some vomiting as well. So it's important not to eat anything from midnight the night before. The other thing is that they're going to do a set of pre-op vitals on you, so things like your blood pressure, your pulse rate, your oxygen saturation. If you've had a fever or if you've got a temperature, you want to make sure that that's all known too. They want to make sure that you're not going to be at risk for any infection. Now, what will happen is they'll put an IV in your hand, and the IV is how they're going to administer the sedation. So in most clinics, it is a nurse who does the sedation, and the nurse does need to have specialty training. She has to be certified with her ACLS, so Advanced Cardiac Life Saving, which is one step further than a basic CPR or BLS training. There will be monitors that you will see as well. Things that they're going to monitor consistently and probably about every 3 to 5 minutes during your procedure is your blood pressure, your pulse, your oxygen saturation, your most clinics will have ECG. Some will also put you on nasal prongs to make sure that you're getting enough oxygen throughout the procedure. The anesthesiologist at some clinics will hook you up to those machines as well, depending on where you're having your procedure. Now, the actual procedure itself does take about 15 to 20 minutes from start to finish. It is solely dependent on the number of eggs you have. So that being said, the more eggs you have, the longer it may take. If your ovaries are in a difficult position, or if they're elevated or tucked in behind the uterus, then they may have to look at pushing at your abdomen to kind of stabilize the ovary, or even going transabdominally to get access to the ovaries to retrieve those follicles. So usually the doctor does know this in advance if you have to have a transabdominal egg retrieval, but sometimes it can be determined last minute. All the doctors that do egg retrievals are highly skilled in doing abdominal egg retrievals as well. Now, once the procedure is done, and at some clinics, or most clinics, they will allow you to bring in a support person with you. So depending on who your support person is, if they're good around needles and seeing you possibly having a little bit of discomfort, then they may be able to accompany you in the procedure room. And this could be your partner, a friend, your mother, you know, a close relative. So it's entirely up to you. Do ask the clinic prior to going in. They can also accompany you in the pre-op area and as well in recovery, but it is dependent on the clinic and really solely on how the person is going to be feeling during the procedure, because you don't want to be having your procedure and then they're passing out themselves. Now, once the procedure is done, what will happen is the doctor or an embryologist may come back to you to tell you exactly how many eggs have been retrieved and how everything went. And then from there, the nurses usually will take you from the procedure area to the recovery area. Now, the recovery area, you're usually there for about an hour, but however, there is criteria for you to meet in order to be discharged. So ideally, when you come out, yes, you're going to be sleepy, you may be a little bit nauseated, you may have some discomfort or tenderness, but that being said, that's normal. And usually with the medications they give, those kinds of things are quick to resolve. So usual recovery time can be anywhere from about 45 minutes to an hour. If you're not feeling very well, if you're having vomiting, then what will happen is the nurse will keep you longer until she seems that you're able to be discharged. So criteria usually is that when you come out, you've got your IV still in situ. And if you're having low blood pressure, if you're nauseated, what will happen is that they will probably push more fluids or keep the IV in until they're thinking that you're not going to throw up, because it is access if you need Gravol or if you need any IV medications to help with any nausea that you're having. The other thing with some clinics is that they will ask you to bring a snack. Some clinics will provide a snack. So usually after about the first 15-20 minutes, the nurse may give you the go-ahead to have something to drink to make sure that you're not nauseated and throwing up. If you can tolerate fluids, then what you will do is move on to having your snack. And some clinics, like I mentioned, will provide a snack for you, which could be crackers or cookies, or if you've been told by your clinic to bring a light snack, you do want to bring something similar to start with, just to make sure you're not going to be nauseated. Once you've been able to tolerate the fluids and say your light snack, then the nurse will most likely have you get up to the bathroom to make sure that you're able to walk independently, and to also see if you're able to pee. At that point, she may also check to see if you're having any bleeding, and that's just by looking in the toilet or even asking you if you're having any spotting or light bleeding. Once you've returned from the bathroom, if you're okay, then what she's going to do is probably remove the IV, go through any instructions, or make sure that you've got a good understanding of what to expect in the next few days after your egg retrieval. So once you've had your IV taken out, in some clinics the embryologist will come out and speak to you as well, just to let you know how the eggs look, how the sperm sample went if you're using a fresh sample, or the quality of a frozen sample if you've chosen to use donor sperm or a frozen backup sample from your partner. And then usually from that point you're good to go. Now the important thing when you're at home or when you're on your way home, it is very normal to still feel dizzy or nauseated or have periods of feeling lightheaded or dizzy for the first day. So we do ask that you take it easy. Don't make any big plans to go out shopping or do anything that is going to overexert you. You kind of just want to go home and go to bed. Also, you want to keep in mind that you did have a needle in your ovaries or in your abdomen as well. So it is normal to feel tender or sore. I always say about 7 to 10 days, maybe even up until you get your period. Your ovaries need time to heal. They were enlarged. Like I said, you had a needle put into your ovaries. So part of the healing process is a little bit of inflammation, which can cause tenderness. So Tylenol, provided you're not allergic to it, is always fine to take. The other thing is that you may have some spotting or light bleeding, and that's completely normal as well. If you're having bleeding more than a period, then you do want to let your clinic know that you've got these symptoms going on. Now, other things to be reporting to your clinic or nurse coordinator is if you develop a fever at any time. You also want to let them know if you're having any concerns with bleeding, bloating, shortness of breath, nausea. If you go home and you throw up, that's kind of expected. But if you're still throwing up like all night after the procedure, then you need to be letting the clinic know. Okay. The other thing that is important to know as well, that if you develop any foul smell coming from the vagina, any discharge that's not normal, if you have a fever, you want to be taking your temperature and then contacting the clinic to say, look, this is what I'm having. It may require you to come back into the clinic for assessment by the doctor, which could be blood pressure, ultrasound, blood work. They will measure across your abdomen so that they can see if your abdominal girth has increased. They will be asking you to measure your daily input and output, so how much you drink. You should be peeing the same thing approximately. And then also if you've gained more than 2 pounds, then they're going to want to know that as well. So those are the things there. Now, the other thing that's important as well is that once you've had your eggs retrieved, if you're doing PGS, or if you're not doing a fresh transfer right away, you wouldn't be starting progesterone, which means that after the egg retrieval, the hormones are going to drop rather quickly. And sometimes the doctor will put you on additional medications to reduce the risk of hyperstimulation. So that being said, it is very normal to have a period, usually 7 to 10 days prior to the expected date, just because of the drastic decline in hormones. So if you're having any spotting or bleeding and you're thinking it's not quite normal, or if it's like a period and you're still not thinking it's normal, do feel free to call into the clinic, speak with your nurse coordinator just to get that extra assurance that it's normal. If it's not normal, if she's got any concerns because of what you may have mentioned to her, then she will have you come into the clinic and be seen, or be able to advise you of your next steps. Feel free to check out my website, www.yourivfnurse.com. Do feel free to send me an email with any suggestions, comments, anything you'd like to hear me speak about, yourivfnurse@gmail.com. Thanks for watching.